I'm Dr. Thompson, Akwo, Ntuba, international political leader, physician, communicator, and editor-publisher of Health and Development magazine. Global health, non-communicable diseases, chronic diseases, cancers. I am giving you updates on what is happening in the area of oncology. Oncology simply means onco, logos, or the study or logos of cancer. But is that all about oncology? As an expert in global health, most of our work is in global health community promotion. And I have traveled extensively to multiple continents and countries around the world. And I can tell you that every country I've gone, every continent I've gone to, there is the problem of neoplasms, whether they are benign or malignant. In pathology, we say a benign health condition or injurious situation is one that is not death causing. And a malignant one is that which creates or causes death or mortality. So, if you understood that from the information you're getting from me as part of our health and development work, you are on the line to working alongside us in global health promotion and protection. There are millions who are affected by cancer every year in different continents and all the countries of the world. Every year, close to 1 million people seem to die. So what is it about cancer which is so evading, which is so challenging? You hear American Cancer Society, you hear this one cancer, this, you hear we are the biggest cancer center of the world, you hear, most of the times we love to promote sickness because we want to show off our big buildings we call medical centers. John Hopkins is a medical center, but John Hopkins is not an agglomeration of hospital systems or medical centers. So when you make noise about medical centers a lot, you got to be able to know who you are fooling, because those things on their own, they have a problem. Yeah, it's good for hospital systems, public health systems to collaborate, to come together, if that requires them to be on the same campus. And if you really think about it, are they really on the same campus? Because the land and the buildings that each hospital system has belongs to that hospital system, doesn't belong to the medical center. And so the medical center in quote is always a misnomer. But now, I said that to say this. The Anderson Cancer Center of the University of Texas, which is a government institution, your taxpayers are actually running it, besides other partnerships that they do here and there. But it's basically a government institution because it's part of the University of Texas health system. Anderson has a lot of research going on cancer. And Anderson is always participating in campaigns. Those of us who are experts in global health communication and doing work in medcoms or medical communication, we work with Anderson in the field because their outreach team, their prevention team comes out, and their education and information team comes out to tell the people about the structure and the functioning of MD Anderson Cancer Institute. That's what I would say. Because I could have said Cancer Center. Why not? But they say it's found in the Texas Medical Center. I thought some people are beginning to say it's the City of Houston Medical City. I don't know why they are interested in all of those nomenclature and appellations. Maybe it tickles their pride, which is a good thing. We pride ourselves in sicknesses. I'm sure if there are no sick people, we will go and create all types of cancers so that we continue to prove that we are number one in the world, which is a good thing. But I continue to talk to you about cancer. And let me make it very clear. A tumor is what it is, a growth. And many times you hear people say, oh, he's got a tumor. A tumor is a growth. It could be a lump, it could be a cyst, it could be anything. The word tumor doesn't necessarily apply to oncology and neoplasia. Neoplasias are new growth, which are growth which are excessive, and they are evading the arrest system of the body. In that lay description, you get to understand, as I said, that we have two types of neoplasms. We have benign and malignant. Now, the other things I want to make is, and the point I want to specify is that a neoplasia can actually grow in any tissue in the body. Any cell can undergo uncontrollable proliferation. Now, there are some situations where people think that, oh, this person has cancer, so they're going to operate. Oh, the person is going to die. No. There is a lot of misunderstanding about what oncology and cancer is all about. Do you know that somebody may have a tumor somewhere? It is benign, and they have to operate the person. And somebody may have a malignant tumor, and we don't operate. Now get that very clear. A tumor may be in the brain, is benign, and it begins to create pressure symptoms in the brain. And the person has headaches or maybe seizures because he's pinching on the nerves and things like that. You know, we have what they call the 12 cranial nerves. And a lot of them are originating from the cranium, from the brain, right? Where they begin to go down as they distribute and do the work that they do. Now, one of the things that I want people to understand is that because somebody is undergoing an operation because of a neoplasia, or an operation because they have been advised by the oncology department of that institution or that medical school, doesn't mean that they have cancer. And because they are not undergoing operation, they may have a cancer. Now, what is cancer? There are different cells of the body. When we talk about the epithelial cell, the mesothelial cell, and endothelial cells, and the three layers of lining, and you have all those cells in the different parts of the body. Each of those cells may actually undergo an uncontrollable proliferation. So, think about it. All the body systems and their organs and their tissues and their cells, they are susceptible to cancer. A good example is breast cancer in the males. Oh yes, I'm a male. I got a breast. This is my breast. There may not be massive fibrous tissue and all of that. I got breast. This is my breast here. Right? This is my breast. So, there's a relationship between my breast area to the armpit or the axilla, as we call it in anatomy, medical school. You don't need to have gone to medical school like me and spend time in the cadaver room and and be cutting and operating corpses or cadavers, and for you to be able to learn all of this and then come out and practice like me. What I am just saying is that we must have these things in perspective, because before we begin to talk about improving health, promoting health, and protecting the health of people. So, males come up with cancer, but the percentage within the population is very, very low. Males come up with cancer of the breast. So, generally, we can talk about ovarian cancer, uterine cancer, cervical cancer, and lung cancer, liver cancer, and some of the causes. Like I was saying the other day, for those of you who are excessive drinkers, you may come up with what we call scarring and sclerosis of the liver. And then it leads to what we call cirrhosis, which becomes a foundation for hepatocellular carcinoma, or whatever you want to call it, the cancer of the liver, for the layman. So just alcohol is an injurious agent, which is carcinogenic. The carcinogen is a cancer risk injurious agent. Some of them are viruses. How many of you have been told that the papilloma virus that affects the cervix have been complicated in cervical cancer? But there are changes, cellular changes, which take place at a micro level in the cervix, especially for women who seem to have multiple sex partners. And we can explain that. But generally, a virus, as I've told you, can become the underlying risk factor for that. So, make no mistake. Then as I said, there are people who smoke. And then the chemicals in the smoke begin to bring about changes in the parenchyma of the lungs and lung tissues and all of that. And then it becomes a risk factor, a foundation for the development of lung cancer. When you tell a lot of people in our global health informations and educational outreaches that, hey, you've been smoking for too long, you're a chain smoker, you're carrying packs and packs of cigarettes, that's not too good for you, it may lead to other problems. You know what to say? I don't care, something is going to kill me. And then when they get cancer, they start getting caring, and everybody doesn't, doctors don't go to sleep, you have to be there, and all. They've lived all their life, and there you are suffering, I'm a physician, I'm that, they're wasting all your life and everything, taking care of them, which is a good thing, but they may be selfish because they were told what was going to happen, and they refuse the advice and the counsel. There are many of you physicians who are actually making that effort. Maybe you work for HMOs and you don't even have time to clock your patients and, investigate and do a great therapeutic regimen and follow up. But even within the 20 minutes or 30 minutes that they give you to see one patient, because you have to see too many in a day, as it requires, so that they can make the money, you still try to fit in, to put in health counseling, health education, health informations, so that we don't have to be too labored out of our everyday general work that we do around the world. But they don't listen. They don't listen to you. How many of you physicians have advised your clients and your patients not to smoke and they refuse? Some of you are just unfortunate. Maybe you had a problem. Like somebody was suspecting that you may be having tuberculosis because you came, coughing with chest pain and related things. Maybe, they ask you if you were productive of sputum, or what we call spit. And that's not even what sputum is all about. Sputum doesn't translate to spit. Especially those of you who are listening to me in Africa. Those of you who have been my patients, because I always told you, as a global health consultant, I still get to talk to patients around other countries, and especially those countries where I am registered as a physician, as a practicing physician. I still get to give people advice from a distance, and I'm like, hey, we've done these researches, we've done these experiments, and this is what, the literature is saying. Nobody wants to listen. But cancer is real. There is cancer of the testes. There's cancer of the bladder. There's cancer of the bone. There are osteosarcomas and all of those things. And I'm sure those are not words you want to listen. And unfortunately, I'm going to say that. You know what happened to our beloved, great superhero, John Mccain of the USA? When they discovered the tumor in his brain, it was already at a stage and degree which not much could be done. One of the main killers of women is breast cancer. That's why we want them at a certain age to do the mammogram. I used to call my sister called Beatrice, and I'm like, hey, I want you to do this, I want you to do that, I want you to check that, I want you to do that. That was nice. I'm sure she used to think, oh, he's always troubling me with this, his medical advice and things like that. No, because I want you to live long. That's why you married me, I guess. You were marrying a physician. And I was doing my job, helping you. The same with my sister. Maybe I was not there and certain things happened, but when I was there and she knew if it was asthma, it was anything, I was very ready. And they were, oh, she's with a brother. A miracle was going to be done. And I did the best for my sister. And when I'm not there, things happen. That makes me to begin to cry. Because maybe they don't get the best of care. Maybe they are not people who hear that, hey, that's Dr. Ntuba's sister and he's around. So if you play the list, maybe your life is at stake. Because he doesn't take nonsense from people. If you make a mistake, you are going to be sued or you have him to deal with. But you know what? I am saying that neoplasms are there. And so especially you, the women, who have these outreaches that you do. You call them different names in different countries. You come together. You raise money. You have speakers who talk about cancer, cancer research, cancer education, cancer information, cancer therapy. We want to say thank you. But there is a need for you to monthly examine your breast yourself. You divide your breast into 4 quadrants and actually palpate. As we do in medicine, you can also do it. All I just need to do is put my fingers and my palm on yours and help you to palpate. If normally you have a baseline of normalcy, if there's a change and you are used to, you can actually pick that there's a lump. And when you do that, you're helping yourself. Because when you notice there's a lump, I don't want you to be anxious and depressed. Having a lump in your breast is not the same as you having a neoplasia or a cancer of the breast. Now, you may not even be able to have noticed that something was going on because it wasn't big enough. If we are able to do histology studies or histological studies and go in there, you will see that a lump that we measure the diameter may be very small but cancerous. And a lump may be very big but benign. And depending on the staging and grading, we may be able to do different things. If we catch it at a very low grade and a very low stage, your ability to recover from it is good. That's why you are advised to do a mammogram, or if you can do it above 45 years, you should do it annually, And then if there is a problem, physicians can take care of that. But we can do prevention. For some people, they have cancer because of radiology to their chest. They have fatty chest, breast tissue, and all of that, and viruses, and many other things I've said cause cancer. So, cancer of the breast can affect a male. It can affect female, but predominantly in women. And there's research that is going on. If it is picked early, it can easily be treated. And survivors are there who can encourage you if you have breast cancer. So don't be anxious. Don't be afraid. We can work together with Anderson Cancer Center and all the other cancer centers and best oncologists in the world to overcome neoplasia or breast tumors.